Part of what people have been talking about are the regular updates coming from government about where we stand in terms of tracking and testing and sort of putting in place preventative measures against COVID-19. What is the latest that we're hearing from government today?
Yes, Zweli, today we heard from Minister Mkhize some of the latest stats. I'm just going to give you a brief rundown of some of those stats. To date, there have been 93,000 people infected globally. There have been no confirmed cases in South Africa. But what government has been telling us, and we heard this earlier this week from Western Cape government as well during their own briefing on coronavirus readiness, they say that it's not a matter of if the coronavirus or COVID-19 hit South Africa, but a matter of when. And national government echoed what Western Cape government said earlier this week in that they believe they are ready. Those 13 designated healthcare facilities that are the treatment, that will be the treatment center hubs around the country, they are geared up for the eventuality of a coronavirus outbreak. All the major ports of entry are being monitored, and there are various measures in place at the different ports of entry, like at OR Tambo International Airport, where they are doing thermal scanning for those international arrivals, especially those coming from those countries like Italy, Korea, where we've seen high number of infected cases. Some of the numbers from those countries as well. Mkhize said that in Korea there have been about 5,000 people infected, in Italy 2,500, and in Iran 2,300 cases.
But MPs had some tough questions for the Minister of Health, didn't they? Including questions about the readiness of hospitals to respond to this outbreak should it hit our shores.
Yes, we've heard from some DA MPs, some EFF MPs about whether or not South Africa's public healthcare facilities are indeed ready. If you may know, here in the Western Cape, Tygerberg Hospital, a state hospital, is one of the treatment centres, and MPs were asking whether hospitals like these will be able to handle a disease of this magnitude should it hit South Africa. MPs were saying that some clinics in the country don't even have running water. How can they possibly then deal with cases of the coronavirus? And will people in rural communities, will people in townships have access to proper healthcare facilities should the virus reach them? And what we heard from the minister and from officials in the department is that all healthcare facilities have been briefed. What the department has been doing as the virus has been spreading and as it seems to be coming closer to South Africa is to ensure that there are education plans in place to educate people in rural communities, in townships, to make sure that they're getting the message across through the media about where people need to go, the number of the hotline, and what they should do should they be experiencing any symptoms, should they have been in contact with people who've been traveling in those countries, in those high-risk countries where infections have occurred.
From our studios in Cape Town, eNCA's Monique Mortlock, thank you for that update.